Welcome back. Joining me now in the Daytime Buffalo studio is Dr. Christian Miliotto of Western New York Pain Relief and Integrative Wellness Center. Dr. Miliotto, thanks for joining me.
Pleasure.
Now, you've been with us before, but for those who may not remember, can you give us a little bit of an overview about Western New York Pain Relief and Integrative Wellness?
Absolutely. So in a nutshell, our clinic is a clinic suitable to those dealing with neck, back, joint, nerve, inflammatory conditions, and balance issues. We are a research and evidence-based clinic. That means no drugs, no surgery, and therapies that actually help people heal from these conditions, get their life back, and go back to living and doing the things that they want to do without suffering with chronic nerve pain, joint pain, or inflammatory issues.
Oh, wow. Okay, so let's talk about how you utilize advanced regenerative medicine and rehab for those suffering with those neck and back pains.
Yeah, so one of the biggest things about people that deal with neck, back, or nerve pain is it's an ongoing issue. We've had it for years and years and years, and the biggest problem we deal with in our community is more than 85% of people are going to have neck, back, joint, or nerve pain as we get older. Most people are told you're old, you have to live with it, and you have arthritis. And that's not true. The issue is, why is your body producing inflammation? Why can you not manage it on your own? And what do you have to do to help yourself? For example, if people have disc herniations, you have to treat them. If you don't treat a disc herniation, it can lead to surgery. If you have nerve damage and you're experiencing numbness, burning, or tingling, you have a condition known as neuropathy. Many are told that neuropathy cannot be treated, and that's not true. You just can't treat it with drugs or medication.
Okay, let's talk more in detail about neuropathy because, like you said, a lot of people aren't aware of what it is.
Yeah, so neuropathy itself, medically, the definition is just people who are feeling numbness, burning, or tingling in the hands, legs, or feet. They call it peripheral neuropathy. The problem is many people can have it from different issues. So you could be a type 2 diabetic. If you have diabetes, you have a problem with sugar. You could have a problem with an ongoing cancer therapy, chemo and radiation-induced neuropathy. You could have Raynaud's syndrome or some type of autoimmune disorder. Or most of the community, they don't have any of these things. They're actually dealing with a neurologic issue from the spine related to the neck or back, which is choking off the nerve root at that source, and the person started to experience these symptoms in the hands or feet: balance issues, numbness, burning, and tingling.
Okay. Now, how do you help people with arthritic joint pain?
Yeah, so all of our therapies can work on any system and body at the same time. So if I'm treating neuropathy or back pain, I'm treating arthritis, I'm treating inflammation. And we use a system of treatments. So normally my therapy is 3 phases. We work on where the origin started. We work on where the nerve pain is and how the muscle is affected, whether it's in the back and down the arm and leg, into the foot, and then how the inflammation is affecting you. Can you stand? Can you walk? Did you lose the ability to go up and down stairs or turn or bend or twist? And we use basically 3 main therapies to do that.
Now, obviously you have your steps, but you also customize plans, right?
Yes. Customization is the most important thing. A lot of people these days, when they go and they see the doctor, they kind of feel like a number. I go to the doctor writes a script. If that doesn't work, I go to PT and do all these other things. The form of medicine we use is the most advanced treatment you can use. And 96% of people who are scheduled to get back surgery, injections, or extended pain medication that do my therapies eliminate that. And customization is what it's all about. Do the treatments the person needs to get the body to heal. For example, we have a class 4 laser. The laser works on cellular regeneration, improving circulation, reducing inflammation. It could work on any part of the body. We have spinal decompression. It'll work on the disc, stenosis, sciatica. We have a special type of machine called a neuromed, which will help to re-educate damaged nerves and muscles. So we can help people with any ailment they have, non-surgically and without any negative side effects. And
you have a seminar coming up. Let's talk about that.
Yep, I have a seminar coming up on Wednesday, December 27th at 1 o'clock. It's right after Christmas. We're about 80% full, but it's an educational seminar for people to learn about their body, the pain medication, why things haven't been successful. Even those who have already had surgery, you can come in and do therapy. It's safe and it's effective, and you can learn about why you're not feeling better, and then what you can do to take control of your life again, and I'd be honored to meet you. It's going to be a lunch and learn seminar.
Absolutely. And viewers, right now what you're seeing on your screen is a flow code that you can actually scan to go right to the registration page for that seminar happening on December 27th. Like you said, it's about taking control over your healing and your body.
Yeah, I mean, the biggest thing that I've learned is most of my people that come into the office are 50 and older, and honestly, a large majority are 75 and older. As we get older, we don't want to be on pain medications that are damaging our internal organs sensations or leaving you feeling confused and lackadaisical. The therapies that we do, a lot of our patients jokingly call them a spa day. They're not uncomfortable. They're sleeping or watching TV or talking with me. And the big thing is you can get immediate pain relief. It lasts, and when you're done with my treatment, you're done. My oldest patient is now 104, and when I met her, she was 99. She came to me in a wheelchair and told me she wanted to walk again. And I looked at her and I said, I can't overpromise and underdeliver, but I'll work hard for you. We got her to walk with a cane.
Wow.
It's not perfect, but she had her life back in her opinion. And we've helped that many, many times over with people who can't do things and lost their social and quality of life and then realized they can have that back. And, you know, as one of my patients say, you want to age gracefully. You don't want to live in pain. And if you're older and you're uncomfortable, it's not fun. You know, and our biggest thing is to help people give their lives back, and it's an honor to do it.
Dr. Miliotto, you're doing incredible work. Thank you so much for coming in and
so
sharing more. And viewers, if you would like to learn more about the Western New York Pain Relief and Integrated Wellness Center or their upcoming seminar, you can visit them online at Buffalo Pain Relief or call 716-650-PAIN. Thanks again for coming in.
Thank you for having me.